So hello everyone, my name is Kara Moncrief. I'm the Clinical Communications Director for Viora. And today, I actually made today's webinar a two-part because I realized it was a lot. So with melasma and PIH, the one that I did last week, it was a lot as well. And I may do that one again in the future just because I want to cover some additional things. And then this one I noticed was even more. So I'm breaking it down to two parts, where the first part I'm going to go through just different types of scarring in general that you're going to see in your clinic, which ones we can treat, and then which ones are a contraindication and why we can't treat them. And the second part is then going to go into the, and then today we'll talk about treatments for those different scars as well. And then the part two is going to be the collagen synthesis. And, you know, we talk about that we are, you know, developing new collagen and strengthening elastin when we are either treating scars or just overall skin tightening for somebody that's starting to get the loss of elasticity. So we talk about this, and you probably do the same thing in your consultations, but maybe you don't know what's the actual process. Like, how are we really getting this collagen? And then we talk about fibroblast cells. What are they really doing? You know, what's the whole breakdown of fibroblast cells into collagen? So we're actually going to dissect that. We're going to dissect the cell. We're going to dissect actual collagen and what collagen is actually made of, and how that whole process works. And I think it will be helpful in consultations as well, not going into the depth that I would or that you understand, because we don't want to, you know, give that much information to our patients. But, you know, we can break it down in a simplistic way so they understand really the importance of having collagen in the skin and how it's really working. You know, how do these heat-based treatments really remodel my skin? Yes, okay, I understand it. I want to buy a package. So hoping that that will be really helpful for you to understand, but also your patients, and then in turn selling more, of course. All right, so we will start with the PowerPoint. Let me share my screen with you guys. All right, so if you guys have any questions, this is going to be a much shorter webinar. It's going to be shorter than melasma and PIH, the other Skin 102 that I did. I think was about an hour and a half, possibly 2 hours. Can't remember, but I do not foresee this one going over an hour by any means. So I think it's going to be kind of short and sweet, just because we're not going to, you know, dive really deep into the collagen synthesis this time around. Just, it would be a lot. Okay, so any questions that you guys may have, though, as we're going through it, we're going to first start with actual stretch marks. And if you guys have any questions after we speak about stretch marks, then and the treatments for them, by all means, you can either write in or, of course, unmute yourselves and ask the question that way if you would like. So don't feel like you're interrupting me. Go ahead and ask away. Okay, so stretch marks. Most of us know about stretch marks and all of these statistics that I have written down, but we'll go through them anyways. So stretch marks, also known as stria. Stria is going to be the medical definition for them. Are a form of scarring on the skin. So we talk about stretch marks being so hard to treat. Why? They're a scar. We know scars are very hard to treat. Why? Because there's loss of collagen in the area, and we actually have some dead tissue in the area. So it makes it very complicated, because not really dead tissue, I shouldn't say that, but you know, we have the lack of, let me admit this person from the waiting room. There we go. But we have the lack of the normal substance that's within our skin. Blood and you know, vascular, I should say, little capillaries in the area, collagen, elastin, fibroblast cells, all of those things that make up our skin and make it very strong. It's lacking in these areas of scars or stretch marks, so it makes it complicated to treat. However, we have treatments for them. So we'll go through that, don't worry. Stretch marks are caused by tearing of the dermis. So that's where it's so complicated, because we're actually tearing the dermis. And you can imagine, if you think back to the Skin 101 webinar, and we broke down, you know, everything that's in the reticular dermis and the papillary dermis and the epidermis, and now just picture that tearing open, and how that's such a, you know, shock to the skin, and why it doesn't really repair the way we need it to. So it's tearing of the dermis, and it happens during periods of rapid growth of the body. And then some normal times in our life that we start to see stretch marks, it's puberty, it's weight gain, bodybuilding, pregnancy. So I thought I didn't have any stretch marks until I was like, I don't know, in my mid-20s. And then all of a sudden I was on vacation and I was getting tan, and then I noticed them on my thighs, and you could tell they were older stretch marks. And I'm sure that happened with puberty. I just, you know, didn't even realize, didn't see. So women typically suffer from it a bit worse, just because of the things that we go through in life. Pregnancy, and such a huge percent of women can suffer from stretch marks because of pregnancy. Puberty, you know, our breasts grow as women, our thighs grow as women, and men, they don't have these areas of rapid growth when you go through puberty. So that's why women typically suffer from it more. But additionally, one of our hormones, so we'll talk about that in just a second. They begin at, oh, I skipped a part. They can occur on a range of body parts, including the stomach, thighs, hips, breasts, underarms, upper arms, buttocks, lower back. With bodybuilders, with men especially, you typically do see it in their underarms. That's a very common area for men. So men can suffer from it as well. They begin as reddish or purple lesions, so they're usually colored. And I always get the question of, is it better to start sooner? Someone has pigmented, or, you know, an actual color to the stretch mark. And that means, yes, they're newer. So the sooner you can start on them, the better that is. So they're going to begin as a reddish or purple lesion. That's when you know they're newer stretch marks. And then over time, they tend to flatten and then lose the pigmentation. So it becomes almost like a clear or white appearance to the skin. And it's because you can think of that skin tearing, and that we have a loss of the melanin in the area, because we have really a loss of those cells, which are the melanocytes that produce the pigment. So usually there's no pigmentation to it. Now, if there is pigmentation, because I'm sure you've seen stretch marks where they're older, but there's some pigmentation to it, you have to keep in mind, what is that? What is that pigmentation? And it's typically PIH. So think back to the webinar that we did last week. PIH, you will go about treating that very, very differently than what I'm going to go through today. Today, the treatment is not focused on PIH, because I would talk about that in a very different way. It's focused more so on the type of patients that you're seeing here in these photos. Okay. And then the affected areas appear empty and are soft to the touch, because we've torn the dermis. An increase in cortisone levels can increase the probability or severity of stretch marks by reducing the skin's pliability. So if someone is getting a lot of steroid shots, cortisone, or using a lot of cortisone type creams in an area, that can really, really, really increase the probability of developing stretch marks if they have any type of body change, like weight gain, or they become pregnant, or, you know, they're going through puberty, something like that. I'm sure they're probably not doing the cortisone shots as they're pregnant, so that wouldn't be so much of a concern, but, or bodybuilding, something like that, where they're just enlarging the body. This can really increase the probability and severity of them. Now, that also plays into the next bullet point, which is cortisol. So cortisol, the stress hormone, which our cortisol hormone is probably very high in 2020. So unfortunately, we're more susceptible to stretch marks this year. But cortisol, the stress hormone produced by the adrenal glands, is converted into that cortisone that weakens the elastic fibers in the skin. So you know how we talk about stress can add to aging? This is why. Actual cortisol can weaken our elastic fibers in our skin and not make it as pliable, unfortunately. So that's why it's really, 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 really good to keep our stress down so we don't prematurely age or get really bad stretch marks. And then over time, they may diminish, but will never disappear completely. So they can diminish to the point where, oh, I don't care about the look of them. You know, that's not a big issue to me. Or you'll have the females that they did not diminish as much because no matter what, they're not going away on their own. But you know, it's much more of a severe stretch mark where they actually come into you and they want treatment. So if that's the case, then we'll talk about treatment of stretch marks. So you're going to see a theme here with the 102 webinars where I'm going to talk a lot about prevention. So it's a two-step process with anything that you're treating. First thing is prevention. And if you can consult with your patients on prevention for a multitude of things. I spoke about this last week when I was speaking on melasma and PIH, and there's different preventative measures for that as well, right? Same thing with stretch marks, and then same thing with scarring that we're going to go into next. So prevention's number one. So let's just say you have a client that you know is going to be competing in a, bodybuilding competition, or you have a client that is now pregnant, but she's not going to get treatments while she's pregnant. However, she's been with you for years, and you know that this client's going to be with you for years to come as well. So talking about in a consultation, preventing them from ever happening is number one. So I just always want you guys to think about that in a consultative setting. How can you help your patients as much as possible? It's not just getting money from them, obviously, right? Because we care about our clients. So if we can prevent any of this from happening, wonderful. Then they won't have to seek these treatments and they'll be so grateful to you. So prevention is maintain a healthy weight, of course. Avoid yo-yo dieting. That's going to play into it. Eat a balanced diet rich in vitamins and minerals. Consuming a suitable amount of vitamins A and C can help support the skin. So not only do we talk about stress can add to aging of the skin, also our diet, everything that we're putting in our bodies. I got the question last week on the webinar with melasma, or was it last week? Maybe it wasn't last week. One of the webinars where they asked, is there a certain type of like collagen cream that you can put on to help boost collagen? And my answer to that, and my answer falls into this bullet point here, is it's more of what are we putting in our body to make our body healthy? Because if we make our cells healthy, then our collagen is going to also be healthier. So just they need to consider that. And that should be spoke about in a consultation too, you know, them understanding that when you eat a balanced diet, it's not just to look good in a bikini, it's for our skin to look amazing as well. So that will help. Aim for slow and gradual weight gain during pregnancy. Now, not every woman can avoid getting stretch marks, but if it's a slow, gradual weight gain during pregnancy, it will help a bit more. I thought I had a bullet point on stretch marks and a percentage of women. Maybe that's for something else. But really what it was is that many women can experience stretch marks when they're younger. Additionally, many women, if they experience stretch marks at their first pregnancy, many times will not experience stretch marks on their second, third, fourth, fifth, sixth pregnancy. So it typically comes with the first one. So, you know, that's good to know as well. But If you're talking to them, oh, I'm pregnant, great. Let's not get stretch marks because I don't want to have to treat that for you. For you, I never want you to even experience them. So aim for, you know, gradual weight gain if possible. This is my third baby. Okay, then, you know, we treated your stretch marks after your first child. Now they tell you I'm pregnant again. Oh, great. Are we gonna have to do this all over again? Aim for gradual weight gain, but additionally, you're not as susceptible at the second and third pregnancy. Okay, drink 8 glasses of water every day. Now, that is, you guys have heard me talk about this. That's not just so standard across the board. What I love to do is that water calculator, because I may need a different amount of water than you, that maybe a 6'5" male would need. Or I'm a 5'9" female and I'm not bone thin, and there may be a girl who's 5 foot who's bone thin that may not need as much water as I do. So I just recommend in your consultation process, do the water calculation on that patient and have it in their chart. Know when they keep coming back in to see you that you're checking in on their water intake for all these treatments, but also it just, again, makes our cells so much healthier. Therefore, they're going to respond better to treatments, or we're going to prevent things from happening in the future. So if you have it in their chart, you know, are you drinking the 2.5 liters of water that you should be? Yes. Okay, great. Are you still working out very heavily? Yes, I am. Okay. Are you remembering to double that water intake on those days that you are working out, doing an Ironman competition? Whatever it may be. Yes, I am. Wonderful. Make sure you stay on them. Heather, one of our trainers that you guys know because she's been on a lot of the webinars, and she spoke about this, that she has a document that the patients sign every time they come in about water, saying, yes, they have been keeping up with their water intake. So it holds them to be responsible. She also puts weight on there, you know, just a reminder, we're weighing you each time you come in. Do you feel like you've had any fluctuations? And it's helped her in her practice grow so much with results of treatments, and her patients are so happy because she's holding them accountable, and they know they spent this money, they want the results. So just a little side note there. Okay, so those are our preventative measures. Now, if they come into you and they already have them, you couldn't consult them on these different things, or you did and they still got them. Okay, that happens. How do we treat them? So I added a few of the Viora treatments, but I added some additional treatments too, because for me, I'm not just teaching you guys just use Viora and you know, these are the results you're going to get only by using this. Don't look outside this box. No, getting results is about all the tools that you have in your tool chest or in your bag. You know, do you do dermal filler? Do you do peels? Do you microneedle? Do you do PRP or PRF? Wonderful. All of these things can combine beautifully with the Viora technologies. So I'll never just have it strictly Viora, because you would be missing out on so much. Okay, so different treatments. Microdermabrasion. You guys have heard me speak about this a million times, to always start your treatments with a microdermabrasion. Why? Just a quick review is it is increasing blood flow to the area, especially on stretch marks. You'll see it right away. As soon as you start using that vacuum with the diamond tip, the stretch marks will go from white or like a clear color to really red. You can see that, okay, we have a lot of blood flow pumping to that area. That's what we want, right? Because remember, in Skin 102, lymphatics and circulatory system, what does blood do for our tissue? A lot. It brings in oxygen to our skin. It brings in all the nutrients that we need for our skin to be healthy. So when we do microdermabrasion and we bring all of those nutrients and oxygen to the tissue, you know it's going to respond better to everything else you're going to do after that. And additionally, it removes the dead skin cells in the area, so we get a better overall experience with our technologies and better depths of penetration. So microdermabrasion, I would always say, always start with that for stretch marks if you have it. If you don't, really look into getting it. We have an amazing one called the Pristine, and this is what it looks like here in the corner. Microneedling. Microneedling is great for stretch marks as well because it is creating a mechanical injury to the area where it stimulates fibroblast cells, and the fibroblast cells will then, we know, secrete collagen fibers. In part 2 of this webinar, we'll go into that in more detail. And then if you do PRP or PRF, you're very similar, adding that in because you know that aids in healing as well. Now, Viora technologies. So if you have all of these, great. You have a lot of different technologies that can treat stretch marks. So the VST, bipolar radiofrequency, it stimulates fibroblast cells. That's what we need. We need to get collagen in the area. So the VST works. If you're just going to use the VST, I highly recommend, if you do microneedling, to pair it with the VST because stretch marks are one of the hardest things to treat. And if you just do the VST, you may decrease the size of them a bit, but the overall texture of them, it's not going to be as great. And if you add microneedling in the PRP, it's going to be that much better. So just think of the percentage of the result that they're going to see. The VST with the microneedling and PRP or PRF is going to be the way to go. Your IPL, I put IPL on here, one, because it also, with heat, can help with overall collagen. But additionally, if it is pigmented. So if there is some PIH in the area and you need to treat the pigment. Now, if it's red, don't get that confused with pigmentation. So it's not. But if they're older stretch marks with pigment, then that could be PIH. So you guys know the IPL can treat that, but you have to go about it in a very safe, non-aggressive manner, just like I spoke about last week on the melasma and PIH webinar. Nd:YAG is going to be great also. You can pair, you can even do the VST with the Nd:YAG because the Nd:YAG offers heat as well and a skin rejuvenation benefit, so it can help. You can even do, a microdermabrasion, a little of the VST, 6 passes really quick if it's a small area. You can additionally do a little bit of the Nd:YAG for overall skin rejuvenation to the tissue. Then you can, as they're cooling down, put some numbing cream on them, let them cool for 30 minutes, and then go in with your microneedling and PRP. So you can combine a lot of these things to get really great results. Now, the holy grail of treating stretch marks is going to be the VFR. So I'm going to be talking a lot about the VFR today because it's the best for scarring in general. So the VFR is going to do 2 things. And if you guys don't know what the VFR is, it's our new FDA cleared handpiece, and it is ablative or non-ablative radiofrequency. So what it's doing and why it's so great for stretch marks. Stretch marks are deep. Remember, it's a tearing of the dermis. Why is it soft and almost divoted when you touch it? You can tell the actual overall dermis has been torn, not just the epidermis, not just the superficial layer. So with the VFR, we're able to reach that depth. We're able to actually get down into the reticular dermis, and it has high heat. So we're able to really get in there and stimulate a ton of healing. And of course, healing equals collagen. But additionally, with the VFR, we're able to do ablation, so resurfacing of the epidermis. And that's where the 2 together are magic for any type of scarring. So deep coagulation, collagen, superficial resurfacing, and resurface the scar in general, or the stretch mark. So if you have the VFR, I would primarily stick to that for treating stretch marks. But of course, you can mix in all of these different things as you go. One patient may respond really great to one thing, and one patient may respond great to another. So it can be, we're not just going to sell you a package of VFR. It could be you're selling them a package of just getting the best results you can with the stretch marks. So that could be that you're doing different things when they come in each time. It could be, and they don't necessarily need to buy, okay, 1 month it's going to be the microderm, ST, and IPL, and then 1 month it's going to be the VFR, or you're going to do 4 VFR back to back every month, and then you're going to switch it over to adding maybe peels or microderm with ST and microneedling. They don't need to purchase it that way. You can just calculate it and know that, okay, this is the treatment program that we're going to do for the next 6 to 8 weeks, and this is how much it would be to minimize the appearance of your stretch marks. And then you can play around with it. But a lot of times you don't need to with the VFR. A lot of times, 6, 8 treatments, and they're beyond ecstatic of the results. So that's really great. Microderm, then this is what's really good too, because a lot of times you need to use numbing cream with the VFR because it is such high heat. Ablation, you can't get away from ablation not being high heat, because to ablate tissue, it needs to be high heat with RF. But do a microderm first, because you want that blood flow to the area, and you'll see the stretch marks will get really nice and red, so you know you have that circulation going. But what's great is you remove the dead skin cells, so when you put your numbing cream on the patient, it absorbs much faster and it absorbs deeper, so they're a lot more comfortable with the treatment. So it really works as a double, helpful thing. You get circulation, but also that numbing cream really sinks deep into the skin to allow the VFR to work in higher heat temperatures, and then allow the patient to be more comfortable. All right. Any stretch marks so far? Stretch marks. Oh my gosh. Any questions so far on stretch marks? I covered it all? Okay. Good deal. Let me just make sure. I don't think anybody's in the waiting room. That would be horrible if they were just sitting there. Nope. Okay, we're good. All right. So we'll move on. I mean, you guys, I've already been speaking for 30 minutes. If I would have added the collagen synthesis to this one, we may have been on here for 3 hours, and I would have been apologizing to you. Okay, so now we'll go into, stretch marks was supposed to be my short one. Now we'll go into scars and different types of scars. So I put down here the most common ones that we typically see. Acne scars, that's a big one. And there's 3 very common types of acne scars: ice pick scars, boxcar scars, and rolling scars. So I actually broke those 3 down slide by slide so we can see photos and also descriptions of what they look like. Then at the end, I have treatments for those types of scars. Then surgical scars, I didn't do a full slide on surgical scars like you're seeing down here. I mean, you guys know what a surgical scar looks like. They're going to tell you they've had surgery in that area and it's a surgical scar, unless it's a keloid. That's going to be a different story. But if it's just a regular surgical scar, they healed as best as they could from it. They didn't have complications like a keloid. The treatment is going to be the same as acne scarring. So, I didn't need to put a slide for that one. And then we're going to go through keloid scars, which is a contraindication, and why it's such a big contraindication, and then hypertrophic scars. So both of those. And a lot of times people get that confused. They may think that they keloid, and they don't. They just have a hypertrophic scar, and that they are susceptible to those. Not as bad as keloids though. So we'll break down the difference of those two. And hypertrophic scars, you can actually do more to get rid of them than keloids. That's a whole different story. All right, so we'll go through the different types of acne scars. So ice pick scars will be the first one we'll speak on. These are going to be the hardest to treat. And the reason being is that they are typically the deepest of all of the acne scars. Now, acne scars typically are just deep anyways. Why? Because we look at like a hair follicle. Oh, hold on, let me admit someone from the waiting room. Okay, great, they're in. We look at like a hair follicle, right? And the sebaceous gland, those are all just, together, right? The sebum and the hair follicle. Where do these follicles and glands originate? Not in the epidermis, they're in the dermis. So acne scars, why are they typically so deep? it's because where was that sebum being trapped? Where is that sebaceous gland? It's in the dermis. But ice pick scars are typically the deepest of the three. So ice pick scars are a deep V-shaped scar that are usually less than 2 millimeters wide. So that's the positive with ice pick scars, is sure they're deep, but they're not as wide as like a boxcar scar. As the name suggests, ice pick scars look like the skin have been punctured with an ice pick. Due to their depth and narrow impressions, more so the depth, ice pick scars are more severe than boxcar or rolling or other types of scarring. Ice pick scars are usually caused by severe acne, such as cysts and papules that occur deep in the pores. So a lot of times when people suffer from nodular or cystic acne, they can end up with these. I personally never had any ice pick scars. I had really bad acne growing up, and it was due to my mom. I just blame my mom on the webinar. Sorry, Mom. But she grew up with really bad, severe cystic and acne, or nodular acne. And I'm not sure, because my mom's done so much to her skin to help her scarring, as I have. I'm not sure if she ever had ice pick scars, but I never did. So so when I did a lot of treatments to my skin, it was easier. When someone comes in with this type, I want to kind of emphasize that you're going to go about it in a way of, oh, no problem, we'll get rid of those. No, sit back, no problem. You have to think of it as they're hard to treat. So we can't overpromise something. You can diminish the look of them very, very easily and well with different technologies, but promising that, oh, they're going to be gone when they're ice pick scars, and knowing how hard they are to treat, just keep that into consideration. And then this is what they look like. Oh, I don't know why I can't. There we go. Okay, another type of acne scar is going to be boxcar scars. So boxcar scars look like a round or oval depression or crater in the skin. They're not always round and oval. They can actually be a square type depression in the skin. So I don't know if you can see my mouse on the screen. I think you can. A lot of these are more oval, but you can see actually here, this one in the middle is more square. And you can see that they have very defined edges as well if you look at them. Okay, so they typically have sharp vertical edges, flat bottoms, and are wider than ice pick scars, but not as wide as rolling scars. So when you get into width, it's like, oh, it seems like the appearance is more severe when they're wide, but that's not actually the case. It's the depth that is the problem. But again, when you're going in to treat acne scars, it's just easier. It may not be as deep as some other scars around. Some scars may be a bit more superficial, because people with severe cystic and nodular acne that will come in for acne scar correction, they could have had a mix of all three. You're looking at their skin and you can see, okay, here's some ice picks, here's some boxcar, here's some rolling scars on the skin. So a lot of times you just have to treat it that they're all deep. But I always think of scarring to be deep, because again, most scars are, surgical scars are, but acne scars, because of where the sebaceous glands are, they're deep in the dermis, or they're in the dermis, they're not in the epidermis. They're typically deeper than we would even think. So depressed acne scars, like boxcar scars, form when too little collagen is produced during wound healing. So we're actually going to go, after acne scars, we're going to go into like the keloid and hypertrophic scars, where it's opposite. It's not too little collagen is being produced when the tissue is damaged. It's that there's not enough, or I'm sorry, that there is too much. I can't talk today. There's too much collagen being produced, so we get a raised scar. And those are actually more challenging. So when we have too little, it's a little bit better than too much. Okay, so then we have rolling scars. This was the type of scarring that I had before I did all of the treatments. And this was more so what my mom's skin looked like too. Okay, so rolling scars have soft and smooth edges and look like tiny hills and valleys, or like an ocean with waves. It's more of a wavy type texture to the skin. Rolling scars have a varying depth, but tend to be shallower with sloping edges that make skin appear wavy and uneven. So because they're a little bit shallower than definitely than an ice pick scar, it's going to be easier to treat. And I think that's why my skin responded so well to the VFR and IPL treatments that I've done over the past, and microdermabrasion. Rolling scars are almost always a result of long-term inflammatory acne. And we're going to talk about inflammation in a little bit too when we talk about the actual treatment of these scars. This type of scar can become more obvious and or severe as you get older, when your skin loses its natural tightness and elasticity. So I always talk about this, how I try to like push memberships for offices. And if you're the type of office that a membership doesn't work for, I completely understand that. So then I switch it and try to push loyalty programs, because you need to have one or the other or both. You have to have a loyalty program if you're not going to do a membership program. So why do I love membership so much? I think it's because I suffered from acne, and I looked a lot older with acne scars. And of course, no one likes acne scars on their face because it makes you self-conscious. So when I started to do, after I did the VFR treatments and really, pretty much got rid of the scarring, I know that my scarring isn't really gone. It's going to be a constant battle for me throughout my life. So if I wasn't in this field, and if I wasn't who I am in Viora and have the ability to do all these treatments to myself, I'm the type of client that would seek out something that I could do monthly for my skin. So that's why I like the monthly memberships. After the VFR treatments, I started to do monthly IPL treatments. And the reason why I started to do that was actually for my hyperpigmentation. So each month I was treating my solar lentigo on my face after the acne scar correction. And I noticed something, that not only did it get rid of my hyperpigmentation, it also made my skin just glow. But the big thing was that it made my pores very tight and small, and also my acne scarring much, much smaller. So I noticed this, that if I do a microdermabrasion and then an IPL skin rejuvenation every month, it's like my scars aren't even there. So again, I would seek out a office that could offer me this, affordably, that I could come in every month and I know I can do the microdermabrasion, I can do the skin rejuvenation, and that you don't see the scarring, and it keeps it really at bay, because scarring is not going away forever, right? Even if you made it look so much better with the VFR, it's a constant, that you need to see them as much as possible. If they can't come in every month for the rest of their life, that's understandable. But if they can come in once every 3 months, then that's great. So that's like a seasonal membership, right? Once a season, they come in and make sure that the skin is as healthy and beautiful as it can look. Now, something else that I noticed was, not only was it keeping my acne scars at bay, but I noticed that I looked younger. My skin looked healthier, so I looked more youthful. And in turn, I know that I have a lot more collagen in my skin and healthier skin than I would have if I, at 39, had not gotten into this industry and never did anything for myself, right? I never got into Botox. I never got into lasers on my skin, or the VFR, or whatever it may be. And now at 39, I wouldn't look the same, I don't think, than I do now, just because I have stayed up on that. So again, that just kind of falls in line with the loyalty programs and the membership programs, and bringing them in as often as you can, because not only is it going to reduce the appearance of the scars and make their skin look beautiful, you're also helping them with anti-aging at the same time. Okay, any questions on that? All right. So treatments of acne scars. The first thing I added here is inflammation plays a key role in development of acne scars. The deeper the inflammation from an acne lesion reaches into the skin, the more likely it is to scar upon healing. This is because, I mean, you're not going to scar from every breakout that you get. How horrible would that be? I still get breakouts all the time. I don't see any new scars forming because they're not, deep like they used to be. So it's more so when the inflammation is deep in the skin and it's a continuous inflammation of the tissue that's a problem. This is one of the reasons that it is important to treat acne as soon as possible to lower the risk of deep inflammation. So again, you guys see a theme. Step one, prevention. If we can prevent them from ever having acne scars, how wonderful that is. So if a client comes in and you notice that they're suffering from acne, I would talk to them. I sometimes talk to people. Oh, sorry. I just needed to bring someone in from the waiting room. I sometimes talk to people that I really don't know, not so much like on the street, but someone that I'm not super close with, but I notice that they're suffering from it. I talk about it because, I think I feel more comfortable bringing it up, I guess, because I had it and I don't want them to have acne scars. And if I see it, I immediately want to run over to them and just tell them, listen, there are so many things that you can do. Let me talk to you, let me help you so you never end up with acne scars because it's the worst thing. So in a consultation, if you notice that, talk to them. If they come in just for acne scars, but you see that they're suffering from active acne breakouts, let's prevent it now from getting worse. So the prevention, avoid picking, that's a huge one. Sometimes they think it's better to, pop the pimple that they have on their face and squeeze it and pick at it just to remove the acne bacteria. But it's actually, I don't know, this is so much fun if you guys are a weirdo like me. If you go to YouTube and watch pimples being popped or squeezed in slow motion, it's the funnest thing in the world. So if you're weird like me, I highly recommend doing that. But when you watch it in slow motion, you can actually see the skin just breaking open. It's like, oh, how horrible. And after watching those videos, I was always tempted to squeeze and pick too, before I really knew skin like I do now. And after watching that, you get a really good understanding of why we don't want to squeeze at the acne lesions. Okay, and then seek treatment for acne. And of course, you guys have the ability to get it under control. Now, if it's cystic and nodular, you know that that's going to be much harder because it's something systemic. A lot of times dermatologists don't know what it is. And they end up having to go and do a bit more aggressive type, not necessarily treatments, I should say like a treatment plan. For me, you could have done all these things on my skin constantly, but because mine was systemic and cystic and nodular, they tried antibiotics, they tried all these different things, but I actually had to get on Accutane. So sometimes that's the case, the patient just needs to get on Accutane. But if it's something that you can take control of, wonderful. So if that's the case, I would always start with microdermabrasion. And just as a reminder, why is that really the dead skin cells are what's creating the complication of acne in the first place. Oh, and by the way, I'm going to do, after the second part to this one, collagen synthesis, the next Skin 102 that I'm going to do, I believe, is going to be acne, different types of acne, like what's really happening deeper in the skin. So I think that's what I'll add on for our next Skin 102. But we're removing the dead skin cells because those are creating plugs over the pore, right? And it's then a breeding ground for bacteria. So we have to remove those dead skin cells. So microdermabrasion, being very soft over the active acne, a bit more aggressive over non-active acne. Then you're going to go in with the IPL blue light, right? So it's the 415 nanometer filter. And you're going to do that 1 to 2 times per week. If they have time to come in twice a week, awesome. If they don't, they have to commit to coming in once a week. And then adding the IPL skin rejuvenation filter, which is the 580 nanometer, or if you have the Nd:YAG laser, you also have the ability to do skin rejuvenation with that, which is the 9.5 spot size. Either will work great at one, reducing the inflammation area, two, getting a jump start on any type of scarring in the area, and three, shrinking the sebaceous glands. Not so much, I always say shrink, I mean it does. It's more so regulate the sebaceous glands. So the sebum, you're not as oily, it's not producing as much sebum when you do these treatments. And they can do that 2 times per month or every 2 weeks. So if you're gonna follow this protocol for acne, the first time they come in, you would do all 3 in the same day. Because remember that the 415 blue light, when you're using the blue light with the IPL, this specific filter, it's a chemical reaction to the porphyrin within the P. acne bacteria. It's not so much heat. So you're not gonna have a lot of heat lingering. Even if you get heat as an endpoint, that's okay. But the lingering heat is not as long as any other treatment that you're doing because it's a chemical response. So it's safe to then go in with the IPL, the 580, or the Nd:YAG skin rejuvenation. So you would do all 3 of these in this order the first time they come in. Then the second week, so let's just say they're coming in once a week. Then the second week, it would just be the blue light, the 415. Then the third week, it would be all 3 of these in this order again. Then the fourth week, it would just be blue light. Then the 5th week, it would be all 3 of these in this order again. Then the 6th week, it would be blue light. So it's every other. So then we'll talk about if it's acne scars that they don't suffer from acne anymore. Okay, what's the actual treatment for that? And it's a lot. You can do a lot for acne scars. Microdermabrasion, of course, I always recommend that. Heels are great as well. You can do, if you're a dermatologist type office, they do something called TCA cross, where they take the TCA peel, which is very, 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 very aggressive. It's not like a Jessner peel where it's just like I sloughed off for a few days and now my skin's back to normal. I looked a little snaky, but no big deal. This is a true deeper chemical peel. And they stretch the skin of the scar. They place the TCA on the area, burns a little bit, but that can really help with acne scarring. Dermal fillers, if you've done everything you can, the VFR has helped a lot, or microneedling has helped a lot with the scarring, but there's just a couple that are like, oh, okay, it needs something else. You can always use a dermal filler in the area. Of course, microneedling, PRP, PRF, for the same reasons we spoke about with stretch marks. And then, of course, you can pair these things, the ST with microdermabrasion, with, I should say it in order, microdermabrasion with the ST, with microneedling, with PRP. The IPL can really help with acne scarring, and so can the Nd:YAG, because they both use really great heat for fibroblast cell stimulation and collagen. But if you have the VFR, that is your focus. I cannot tell you how phenomenal it is for acne scarring. I mean, it's unbelievable. And how unbelievably happy these patients are after they see the results. It makes you want to cry. So of joy. So if you have the VFR, I would stick to that. If you do PRP or PRF, it's something we've talked about in the past of doing a study. And now that we have the VFR handpiece and it's cleared by FDA, we might be able to do this study. But adding PRP to your skin or to their skin after VFR is fine. And it may help a lot. So, and if it does, email clinical, please, because we wanna know about it, and we wanna do possibly a paper on that. How exciting. So if you have a VFR, stick to that for acne scarring. And then what I really love for me personally is I did the VFR treatments. I completely changed my texture of my scarring. Can't really see it much anymore. I mean, I can because I'm hypercritical, but most people when they meet me say, oh my God, I can't believe you had acne scarring. You guys know I lecture a lot. So I'll lecture about it. And then when I'm done lecturing, they'll come up to me and say, I would have never known. So, but for me, of course, I'm hypercritical. But what I really am very good at is before those lectures, I would do a microdermabrasion and an IPL skin rejuvenation. So of course my skin looked great. If I didn't, then you might be able to see the scars a little bit more. So I'm big on that, is you don't have to maintain with the VFR. You can just do the VFR once a year. If they don't want to go through that, you know, every 6 months, then okay, great. We'll just do the VFR once a year so you don't have to go through the downtime and all of that, which it's not a lot of downtime. Of course, it's just social downtime, but you know, they went through it every month and it's like, oh, okay, I don't want the social downtime anymore. Okay, we'll do it once a year, but every month or every 3 months or every 2 months, however you guys want to do it with the patient, you'll come in for microdermabrasion, exfoliation, and skin rejuvenation. Okay, great. And that's how they can really maintain their skin youth and beauty by diminishing the look of the scars. All right, any questions on that? And remember, you guys can write into the chat if you don't want to unmute yourselves. All right, so now we'll talk about the type of scarring that we don't treat with Viora. You may be a dermatology office that you do treat these things. You may be a plastic surgeon's office that you do treat these 2 different types of scars. But with Viora, we don't. Especially keloids, and we'll talk about that it's actually a contraindication and why you should really stick to keeping it a contraindication. So the first thing we'll talk about, which is not as severe as keloids, will be the hypertrophic scars. So a hypertrophic scar is a skin condition characterized by deposits of excessive amounts of collagen, which gives rise to a raised scar. So instead of the collagen not being able to keep up with the major inflammation of acne, in reverse, the opposite of that, it's actually producing too much collagen at a very fast rate. And then the next bullet point is when a normal wound heals, the body produces new collagen fibers. So we know that, you know, that's our wound healing process at a rate at which balances the breakdown of old collagen. So hypertrophic scars, it's just doing this at a much faster rate and a much higher rate than normal. It's the skin, or I'm sorry, it's the body's response to this. It's like, ah, and it's just doing too much, too fast. Hypertrophic scars are red and thick and may be itchy or painful. So that goes with keloid scars too. They can be very itchy and they can be painful. They often contain nerves and blood vessels, so hence why they can be itchy and painful. They do not extend. Here's the big thing, big takeaway, because like I said, a lot of people will confuse hypertrophic scars with keloid scars. And if they truly are keloidal, if this patient really, really does suffer from keloid scars, you can't do anything to them. But if it's a hypertrophic scar, it's not as severe. So here's the big takeaway, if you maybe didn't know the difference until now, it is they do not extend beyond the boundary of the original wound, but may continue to thicken for up to 6 months. So that's the big thing. The huge difference between keloids and hypertrophic is if this woman or man cut themselves and it was that size and it did not extend, you know, beyond the border of the actual wound, that's going to be a hypertrophic scar. But if it did grow beyond the boundaries, that's going to be more of a keloid scar. They form most often at the sites of pimples, body piercings, cuts, and burns. They generally develop, so any trauma. They generally develop after thermal or traumatic injury that involves the deep layers of the dermis. So if someone is susceptible to hypertrophic scars and they got a true, second or third degree burn, then a lot of times they can end up with hypertrophic scars because you're really then deeper into the dermis. Mechanical tension on a wound has been identified as a leading cause for hypertrophic scar formation. So when there is a lot of mechanical tension as the wound is trying to heal, then the patient can end up with a hypertrophic scar instead of just a regular flat, unraised scar. Hypertrophic scars are red and raised to begin with, but after time they become flat and pale. So that's why I added really both of these photos. So you could see a hypertrophic scar that's newer and then a hypertrophic scar that is older. Hypertrophic scars, just said that. Next one, hypertrophic scars still starts with the same thing, usually improve over 1 or 2 years. So a lot of times they can improve so much that, they no longer look like this, really raised and, something that really bothers the patient. So over 1 or 2 years, they may not really care about it, may not want to do anything for it. But if it's much larger, like this one, then they may. So the big takeaway here, though, is treatments for them. I made a few bullet points here. I didn't put treatment down because we're not going in with the Viora devices to try to treat these next 2 scars. So I didn't actually make a slide for it, but I did put some notes here. So with keloids as well. Actually, I'll read that after I go through keloids. Let's just wait a second. Oh, and by the way, I said that I had some statistics about the stretch marks that I was like, why didn't I put it down in the slide? I actually wrote notes. I forgot. So I spoke about, this is stretch marks. So sorry, going back, I just don't want to forget to say this. I talked about that it happens typically in younger females with pregnancy. The older you get, the less chance you have of stretch marks, which seems like total opposite, right? Higher cortisol levels, I spoke about that. Not as common after the first pregnancy, spoke about that. Oh, here it is. 45% develop stretch marks before 24 weeks of pregnancy. So if you're going to talk to your females about that in a consultation, a huge, large amount, a big percentage of it, 45%, actually happen very soon before the first 24 weeks. So you can talk to them about that, possibly like wearing vitamin E and maybe Aquaphor. I know one of my girlfriends wraps her belly with Aquaphor and saran wrap, and she's never gotten stretch marks. I don't think there's any clinical proof to that. But little things that they can do and know that they actually can happen half the time before you even hit 24 weeks. And then over 50% of women are affected. It's a large percentage. So talking to them in a consultation may help. Try not to gain a ton of weight during your pregnancy. So those were just some notes there. Now I'm going to wait to read my notes after we talk about keloid scars on different treatments for these 2 different types of scarring. Okay, so now we're going to keloids. Ugh. So I sometimes get emails to the clinical department saying, we have a patient who has suffered from keloids in the past. Can we do skin rejuvenation on her? Can we do microdermabrasion on her? And my answer is always no, it's a contraindication. Of course, I can't stop any of the offices from trying it or testing it and seeing how it will respond or go. But my huge suggestion is that anybody that suffers from keloid scars, never take the risk, never take the chance, because they're so susceptible to these. And microdermabrasion, even a bug bite can create a keloid scar on them. A scratch can create a keloid scar on them. So then you think about these Viora treatments and what they're doing, really high heat, even low heat sometimes, the VST, exfoliation with the microdermabrasion, we're messing with the skin. So they can easily keloid scar, and good God, can you imagine? So they just should never take the chance. And I'm sure that like their dermatologist, when they originally had keloid scars and they maybe went and saw their dermatologist, have spoke to them about this, that, hey, listen, in the future, if you're ever having surgery, make sure to tell your surgeon that you are prone to keloid scars. You know, avoid any type of like cosmetic procedures if you can. So I'm sure that they already know these things, but sometimes they don't. So if they're coming into you, I wouldn't take the risk. Okay, so keloids come from the overgrowth of scar tissue, so similar to hypertrophic scars. Keloids can be much larger and grow beyond the boundaries of the original wound. So this female here, I'm sure her wound wasn't that size, right? So it grows beyond that boundary. Here, down here, she has another keloid. Maybe she got a belly button piercing. Here, maybe she was okay with her first ear piercing, great. So now let's try piercing a couple more times above, and now you end up with keloid. So that's where it's like, don't take the risk. Okay, it can take 3 months, and again, that grew beyond the size of injury, of course. It can take 3 months up to a year before you see the first signs of a keloid. That's scary if you took the risk and did the treatment, and then it happens a year later. Ugh, yeah, don't want to get into any of that type of lawsuit or doing that to somebody, of course. Then it takes weeks or months for it to grow. Sometimes they can continue to grow slowly for years. They are commonly found on the chest, shoulders, earlobes, and cheeks. However, keloids can affect any part of the body. An estimated 10% of people experience keloid scarring. So if you're thinking like, oh no, this is gonna really put a damper on my business because we can't treat anybody that is prone to keloid scars. Well, an estimated 10% of people experience keloid scars. So it's not a huge percentage, thank goodness. Men and women are equally likely to have keloid scars. Now here's a big, big, big one. People who have darker skin are 15 to 20% more likely to develop keloid scars. The African American or just African descent are much more likely, the percentage is higher, but also Asian and Hispanic skin types, so just darker skin types in general. You typically don't find keloid scars on Caucasian, European skin types. So that's a big one, that's a big takeaway there. Keloids tend to have a genetic component, because if you're trying to decide, is it a keloid, is it a hypertrophic, you know, maybe I want to try to treat them if it's just a hypertrophic scar, but I would never touch them if it was a keloid scar. If you're questioning it that much, you send them to a dermatologist and get it checked out, to be safe, of course. But those are the things to think of. It spreads beyond the boundaries. Are they dark skin? Okay, this is where we're leaning more towards keloid than hypertrophic. Keloids tend to have a genetic component, which means you are more likely to have keloids if one or both of your parents have them. So question them. Do you have sisters and brothers? Do they keloid? Do your parents suffer from keloid scars? So you can find out that way as well. Also, if they had a keloid when they're young and never experienced it again as an adult, it doesn't mean anything. If they experienced it as a child, they can absolutely experience it as an adult. Maybe they just haven't had a major injury to cause one. Keloid Keloid scarring is common in young people between ages of 10 and 20, but even common into their 30s as well. So you typically will find it more so on younger individuals. And why? It's because our collagen and our fibroblast cells are more abundant when we're young. So if they are prone to this, it's, remember, overgrowth of types 1 and 3 collagen, and it's so abundant when we're young. So that's why you'll see it, commonly when they're younger, but up to 30 years old too. Okay, so then just a few pointers that I made here off on the side. Treatments. So again, I didn't put a slide here for treatments because it's not something that we're doing with Viora, treating these types of scars. But things that they could do that you could tell them, listen, I don't do anything for this, but a dermatologist can if they, and here's the thing too, hypertrophic scars are a lot easier. A keloid scar, a doctor could try to perform one of these treatments, and it could be worse because there's such little keloid scars. So they could try to cut it out, and now it's even larger than it was in the first place. So a lot of dermatologists want to leave it alone because they don't want to take the risk. But things that they can do, steroid shots to the area. There's a big one with keloid scars where they put like a mechanical compression, like a device type thing on the keloid and compress it, and that can help. Keloids can be itchy and painful as well. So, steroid shots can help with that. If it's large enough and on a joint, it can actually cause the patient loss of mobility, or not complete loss of mobility, not always, but yes, it can have effect on that. Freezing it is another option for both of them. Silicone sheets, they put a sheet of silicone that helps. Sometimes kind of like the mechanical compression can help, and then surgical removal. Again, a lot of doctors don't want to take the risk, but some do, and some are good at it. But here's the thing, it doesn't matter how good you are, it's the patient's body. What's going to happen after the surgery? So, a plastic surgeon that's going to do a breast augmentation on a patient who suffers from keloid scars definitely is going to talk about that. Listen, I can be the best surgeon in the world, but if you're prone to keloid scars, you can have them after the surgery because that's how your body responds. It's its own healing process. But they can do things like radiation after the surgery, after the surgical removal, to help. So there is some hope there. So the coloring of keloids, they can be pink, they can be red, they can be purple, they can be brown, they can be the color of the patient's skin, they can range. And it darkens with time, so the more time that goes on, the darker it will become, and they typically are darker around the edges and lighter in the center. So that's something that you can look at to try to spot them. Some are soft and doughy to the touch, but some are hard and rubbery to the touch. So they can be either or. So those are my side notes there. So remember that this is going to be a continuation into that collagen synthesis. So, what's happening to that scar tissue when we're using these different devices and technology, and what are we doing inside the skin? How is it working so well? So we'll break down collagen synthesis in part 2. I don't have a date scheduled yet for part 2. So as soon as I do, though, it's going to be this week or next week that I pick the date. It will be up on the Viora Online Academy. So check back in next week, maybe towards the middle or end of next week, and you'll see the additional, I'll add 2 additional webinars. So that one, part 2, and then another Skin 102. And I think I'm going to do acne, like different types of acne. So you can easily spot that. But I haven't decided. There's so much that we could talk about. So, but just check back in, Viora Online Academy, just to see. Okay, any questions? You guys can either unmute yourselves. I think you can unmute. I'm not positive. You used to be able to, but maybe that's changed. Or just write into the chat. So I see someone just wrote in. Where can I register for the next webinars? This was very informative. Oh, good. The Viora Online Academy. So it's actually I'll just type it in. So it's www.vioraonlineacademy.com. Sorry, my computer's super high, so it feels weird. Okay, VioraOnlineAcademy.com, and that's where you can register for all the upcoming webinars. Additionally, if you weren't on, I'm doing a full, you're welcome, I'm doing a full Skin 102 series. So I started with Skin 101. Skin 101 was just breaking down all the layers of the skin, the cells, their functions, things like that. And then I broke off from Skin 101 and I did a Skin 102 series. So all of the ones that I've done so far, you can go back and watch from there as well. So I did the circulatory and lymphatic system and how they work with Viora treatments. I did melasma, the hardest types of pigment that you're going to see and treat, melasma and PIH, and how to treat those and how to go about those. I may do that one again because I think it's an important one. And I feel like I forgot to mention a few things that I think about. I'm like, oh shoot, did I say that on the webinar? So I may film that one over just in case I did forget anything. But you can watch that one. And then, of course, this one you were on. And then the continuation part 2 will be that collagen synthesis one. So, so just in case you haven't been on the previous ones, that's the breakdown of them. Catherine, great information, thank you. Oh, good, you're welcome. I sure hope that this did help, because I think these were important because we talk about these things so generalized, right? So, you know, pigment, you know, melasma and PIH just kind of fall into pigment. Okay, we'll just treat them the same. No. Acne scars, someone comes with acne scars. Okay, we just treat them all the same way. Well, it's good to know, you know, how deep are they? How easy are they to treat? What can we promise or not promise the patients? A lot of times, you know, you may be turning away people that had hypertrophic scars, but are yeah, hypertrophic scars because you thought they were keloid scars. Not always. And it's a hypertrophic scar is not a contraindication. I still say be more gentle. Don't have your heat as high if they suffer from hypertrophic scars, but it's not a contraindication where keloids are. So, you know, being able to spot maybe the difference easily for you. And then stretch marks, of course. Thank you so much for being on, and we'll see you soon. Promise to update the online academy with new dates coming soon.